Hello everyone, this is Shafiq Safi live from Centre Endodontics Saint Laurent in Montreal, Canada. Today we're going to cover a very important topic, or a couple of topics. The first one is a question that I get a lot from my patients, and it is, how long will I be numb for after having a root canal treatment? So as you know, before any dental procedure, and especially before root canal treatment, numbing the patient or giving him adequate local anesthetic is a very important step in order to offer the comfort for the patient so that he or she does not feel any pain or anything that is done during the treatment. Usually this should last about the totality of the intervention, which is about 45 minutes to an hour or an hour 15. And after that, the local anesthetic will start to dissipate slowly during the course of the day. In about 45 minutes to an hour after leaving the appointment, the patient starts to feel again the sensation in the area that was treated. So I would say from the moment that the anesthetic solution is administered until the patient gets back his sensitivity in the area, about 2 hours or so. However, here at Centre Endodontics Saint Laurent, we do offer an alternative for our patients. In some specific cases, what I can offer for the patient is a local anesthetic reverser, or if you want, it's a molecule that can administer, that can stop the effect of the local anesthetic and fast forward, if you want, the gaining again of the sensitivity of the patient. This is done only for specific cases, and if the patient asks for it, we offer it free of charge here at the clinic. If you have any additional questions concerning local anesthetic, their duration, how they work, please don't hesitate to contact us at www.endosaintlaurent.ca. Thank you.